Testing, 1, 2, testing.
Okay, everyone, we're going to start. Welcome everyone to the first meeting of the Wokingham Borough Wellbeing Board. Could I have nominations for Chair for the year, please?
I'd like to propose David Hare.
Do we have a seconder?
Yes, I'm happy to second that.
Do we have any other nominations? Okay, Councillor Hare, you are now chairman.
Thank you very much. Your task for the day. No, I've got to make notes. I need the appointment to have any nominations for the appointment of the vice chair, and I'm going to propose Debbie Milligan. Seconder.
Happy to second that.
Do we have any other nominations? Don't think so. So, assuming your contact, Debbie. Do we have any apologies? I'm assuming Debbie is one of them.
Yes, Debbie Milligan, Graham Evers, Sarah Deason, Sarah Webster, and Belinda is kindly substituting for Sarah Webster.
Thank you very much. So we look at the minutes of the previous meeting. Does anyone have any problems with these? Thought they were a good, accurate record. So everyone's okay with that. Thank you very much. Has anyone got any declarations of interest? No, no one's interested. We haven't got any members of the public here, I don't think. No. So, and we haven't got any member questions either. Right. So I think that's you, Robert, about the joint board plan.
Brilliant. Thank you very much. That was quick. So for those that don't know me, my name's Robert Bowen. I am the Acting Director of Strategy and Partnerships at the ICB, Integrated Care Board. And I have had the privilege of trying to pull together the first of what's called the Joint Forward Plan for Buckinghamshire, Oxfordshire and Berkshire West system. And what I'll do is just, because I'm conscious that as a group we have seen this before, we've shared it. So just for the purposes of this meeting, just quickly explain what the document is for, how it's been compiled, and then I think there's probably some discussion, but this time we're bringing it with a very specific request in terms of an opinion on how this aligns with the existing health and wellbeing strategy for Berkshire West. So that's where I think we'll go as we talk through. So the joint forward plan is a document that is trying to do two things really. One is to describe how we will provide the NHS services to meet the needs of the local people. And the second is to reflect some of the longer term ambition that has been described through the integrated care strategy. And through the development of this plan or set of plans, we have lent very heavily on the ambitions that have been set out in the integrated care strategy, which in themselves were built on the foundation of the health and wellbeing strategies that existed across the three different places, including the joint health and wellbeing strategy for Berkshire West. The document is a plan that is for the NHS bit of the system. So it is describing the plans and ambition and how the NHS partners, so the ICB working closely with the NHS trusts that are working across the whole of the BOB system. And it is describing how the NHS aspects of the system will be delivering both the universal NHS commitments and the aspiration of the strategy. I think I've explained it before, just in terms of navigating around the document, really, I think it's helpful to think about the way in which we pulled the document together in two parts. There's one part that's got lots of detail in it, which we've pulled out into an appendix, so it's easy to sort of pull that out separately, which very closely aligns to what we've got in the integrated care strategy. So we've used the same structure of the strategic priorities about promoting health, then services around start well, live well, age well, and then a number of services that will be provided across the system, but in terms of accessing high quality services. That's one bit, and through all of that, I think colleagues will see that we've got a very strong intention there to do more in terms of prevention, to do more in terms of identifying and tackling inequalities, and those are themes that are picked up really consistently through the service delivery plans. I think another theme that comes through is one of partnership. An ambition that over the course of the delivery of this plan, our partnerships will develop and evolve and will be able to be much more integrated in the way in which we are planning and delivering the services that will be provided. The other part of the plan that I think is worth just drawing attention to is we've identified a number of challenges that we know that we need to face across the system, and we've pulled those challenges out because those are things that we very specifically know that we need to be working on together as a system. And there's a challenge there around inequalities. There's a challenge there around the need to do more to keep people healthy and well in the community. There's a challenge there around how people experience our services, particularly in terms of waiting times and access. And finally, a challenge around sustainability, looking particularly at financial sustainability and some of the challenges that we have around our workforce. For each of those challenge areas, we have identified one priority action that we want to focus on for 23-24, so for the rest of this year. and at the same time recognise that there is more work that we need to be doing to develop that sort of 5-year perspective. And I'm happy to talk through what those actions are if that's helpful. The ambition is that by the end of this year, we will have more developed plans that give us that long-term perspective, because the joint forward plan is something that will be refreshed annually. So it is basically going to become a rolling 5-year plan. For subsequent years, this will be aligned very specifically with the rest of the NHS planning that happens. So it will be happening at the end of the financial year, aligning with the operational and financial planning, so that we've got a set of plans providing both the sort of short-term operational intentions as well as some of the long-term ambition that we've got. So that is the purpose of the plan. In terms of how we've pulled it together, we have been working across the NHS partner organisations to make sure that we are taking a perspective that covers all of the different aspects of NHS delivery. And as we've been doing that, we've also been engaging with other bits of the system, notably with local authority colleagues, particularly where there are links to be made around the service delivery plans. So we've had involvement through that. We published in public a version of the plan in April. That was open for public comment until towards the end of May. And so there's some feedback that we've had through that process. We had a series of focus groups that ran in May, where also we were able to get some very specific feedback that has been factored into the development of the plans. And I think we had a conversation as a group in May as well, which was helpful. In terms of next steps, we have a duty to publish a final version or a version of this plan at the end of June. So we are intending to do that at the end of June. One of the things that we are asked to do is to ask our local health and wellbeing boards for an opinion on how well the plan aligns to the existing health and wellbeing strategies that you have. So I sort of throw that open for discussion, but refer back to the fact that kind of this has all built on the priorities that came out, and we've tried in the paper that's been circulated to make clear what those connections are.
Hopefully, sorry, everyone's seen the letter we've written in response to that, so hopefully we can go with it.
Thank you. Thanks. Yes, we can only have a maximum of 2 on at once. So, we've had an informal discussion, as you announced in May. We've got a draft response. I suppose the question, which I agree with, I've replied to say I'm happy with it and it will go forward. Supposing that the response was slightly different and we said absolutely you haven't got any of our priorities in there, would that have made any difference to anything? So what actually, I suppose it's a way of asking, what actually do you do with our comments afterwards?
I hope that we've had sufficient time to gather your feedback, listen to that. I think it was unfortunate the timing of elections this particular year that we weren't able to do that quite in the way that we were planning to across all of our different local authorities. But the idea is that we are working to understand and make sure that we are aligned, taking on feedback as we go through. This for me should be the end of the process, not sort of part of it, as it were.
A quick follow-up, David. So if, I mean, I'm not saying they are, because they aren't. We are pretty well aligned. So would you then take what we'd said this year and then feed it in for next year? You're going to do one next year and
So absolutely, and I think the way that we have done develop the plan this year, as in the guidance was published just before Christmas. There was then additional guidance that came out through January and February. Originally, we were hoping to. There was an aspiration that we would publish in May, but because of the requirement to do more of this engagement work, that's been pushed back. I absolutely, over the course of next year, would hope that the way in which this is developed is more of a partnership than it has been this year. So, and would really kind of, one of the things that we want to do over the next month or so is to have a lessons learned session. And I think one of the kind of, if there's feedback about how we can be doing the process differently or better next year, I really value the feedback.
Thank you. Ingrid.
Thank you, Chair. Just a few points, I guess, around this. So we have, as Councillor Bray suggests, we've got a draft response, and I think that we are in agreement that the JFP priorities the Joint Forward Plan priorities do align with the health and wellbeing priorities of the Berkshire West Wellbeing Strategy and also of our Wokingham locality strategy into action. That said, I do think it's also important to underline some of the differences in our focus. So the work of this board and of our strategy focuses on the wider determinants of health. And a lot of our work is in that space, and the Joint Forward Plan doesn't have that focus, whilst it does have similar priorities. So I think that there is a difference, and that difference is important to be noted. I think the other thing that it is important to note is that whilst the Joint Forward Plan talks welcomely about a data-led approach, particularly maximising the use of population health management, data approaches at a large footprint by themselves don't give you the intelligence required to address local problems, and it's local intelligence from partners around a locality board such as this that will give you local intelligence to properly target the priority work of the Joint Forward Plan. So it's just an ask really to make sure that local intelligence is added to your system level data approach. And lastly, we've discussed this, and I know it's in train, but I think it's important to mention that we would really welcome the outcomes of your Joint Forward Plan feeding into this wellbeing board. What the work that you are doing is so closely aligned to what we are doing here that we would really value seeing the outputs of that work and the outcomes of that work in this space. But I know that work is happening to take that forward. So those were my three main points. Thank you, Chair.
Ingrid, do you want to say anything, Robert?
So Ingrid, thank you. Really helpful feedback, and I've seen the proposed letter that is proposed. So in terms of the wider determinants, it's absolutely something that we collectively as a partnership need to ensure that we continue to focus on and to get right. So would really value kind of continuing to work through with colleagues about how we do that. I think realistically, the majority of that will be delivered, will be done through the place-based partnerships, and trying to understand actually what's the role of the place-based partnerships and trying to develop the right actions that will meet the local population needs and build on that. So I don't know if place colleagues want to sort of build on that at all. The data approach and making sure that we're tapped in, I absolutely completely agree that kind of cold data is useful, but actually making sure that we have local intelligence that builds on that, I think, is going to be really important. We have some system level sort of infrastructure governance that will support how we make system level decisions using some of our population data. But again, how those plans are developed at a local level is going to be something that will be happening through the place-based partnership. So again, that local intelligence sitting alongside the data that we've got coming in from multiple different places absolutely should be part of the picture as it's developed. I completely agree. Finally, in terms of reporting, in principle, yes, kind of the detail of exactly how we do it, I think needs to be ongoing discussion in terms of the data that comes back here, how we share that, how frequently it comes here. Let's have a conversation about it and then bring that back to the group. In terms of what's being proposed for the ICB and reporting up to the ICB, we are proposing that there is a formal report that goes twice a year to the ICB board, providing an update specifically around the delivery of the joint forward plan. I know that there is a workshop next week for the ICP, so the Integrated Care Partnership, about how we, and one of the points of discussion I think there will be, how does the ICP want to monitor and assure delivery of the integrated care strategy? Those two things are linked. So I think it's a bit of an iterative process, but in principle, yes.
Thank you. I was going to ask a question about some of the financial information that's on page 26. There's a note here that 22-23 deficit of 30.6 million, aiming to achieve financial balance 24-25. There's a lot of stuff here about strategy to be developed in 23-24. I was wondering what the position was for 23-24 and whether you think you're on track to actually achieve that as where you are now, recognising there's a lot of work to be done, and also recognising anyone who turns on the radio knows the pressure about basically the NHS is under at the moment, and it must be very difficult. I mean, just would welcome some comment on that.
Good, so helpful question. And one of the, just as we've been developing the plan, one of the things that we've been aware of is that actually in the financial position that we have and the certainty of the sort of longer term financial position, we can really only do very detailed specific planning for 1 year. So the development and detail of the plans that we've got in here, we know are aligned and deliverable for 23-24, because we've done that as we've been going through the operational and financial planning. The process that we'll go through to ensure that this is updated on an annual basis and continues to give that rolling 5-year position will allow us to continue to take stock of the financial position, and ensure that the plans that we're producing are realistic within the constraints that we're working in.
Thank you for that. I mean, obviously the figure in here is 22-23. Do you know what the financial position is looking like for 23-24 as of now? Are you on track to achieve balance, or?
I haven't seen that position for the whole of the system. So what's reflected in there is a system number. And so at the moment, I haven't seen the absolute latest. My understanding is that given the importance of this, there have been very, very detailed conversations about what's achievable, what's not achievable. So I haven't seen the latest position to give complete assurance, but.
Sorry, one final one. I'm guessing that's going to be made public in April 24 when the strategy is published.
What specifically will be made public in 20?
Where the figure is for this year.
There will be reporting that comes through the various different boards across the system that will provide updates both the different organisations and across the system as we go through the year. The boards that we hold up are public boards, and there'll be financial reporting that comes out through them.
Sure. Thank you. I don't think there's. Oh, you've got. Oh, Ingrid's got another question.
Sorry, it was just a follow up. I just had to come back on the idea that wider determinants of health were the responsibility of place, with NHS partners being one of the biggest employers in our community, and with the reach that they have to our residents and their families, they are absolutely key in helping us tackle the social and wider determinants of health. It isn't something for the place-based partnership alone. So we do need our provider colleagues within the NHS to work with us on that. So just a plea to not pass that baton to place in its entirety.
I am happy with that. That's fine. Yeah. So I think we all have a responsibility to be working together on this. I don't think I'm not trying to say it's not a system thing. I'm just saying the reality of kind of the detailed planning and partnership delivery of this. The majority of that, I think, will be felt at a place level. But there needs to be planning, coordination, and oomph put behind it at system level. Absolutely.
Thank you, Chair. I just wanted to come back actually on something that Ingrid was saying, really, is a good reminder. So the place-based partnership, we know how is developing its governance and also developing the key priorities, the programmes of activity that sit behind that. We did some initial mapping back to the ICP strategy, but I think Ingrid really has given me a good reminder that actually we need to also look back and map to the joint forward plan and just make sure that those connections are there and that we actually understand where within our priorities the joint forward plan actually sits. So that's an action that I can take back. I think the other thing to come back to, I think it's Charles, yeah. So we had a good, so I haven't got all of the kind of detail around the money, but I do know that the Unified Executive, the place-based partnership, had a discussion about money in terms of how the money flows. And one of the things that I'm aware that the ICB, obviously there's a new Chief Finance Officer in post, is really around trying to have that balanced budget. And I'm sure he's working through that detail. But with some of the schemes, I know that there is some slippage on some of them. And I know it will be coming to a future board about one of the particular programmes of activity that we're working as one of our priorities, which is around the Inequalities Fund. I'm sure that more detail will actually follow, but just to give that level of assurance that also at a place-based partnership level, we are looking at the money. Thank you.
That's it. Well, I just wanted to say two things. I mean, one, it's obviously been said by Ingrid, but certainly about inequalities, and data doesn't tell you everything. And we're healthy and wealthy, so a lot of our inequalities get masked because of that. So we have one of the highest levels of, for instance, of people with learning disability, but people don't see that because we're healthy and wealthy, and so we have problems which we have very little funding to meet. And that's almost a problem with being healthy and wealthy. I mean, and so it's something that we need to look at and look at it realistically, if at all possible. But then the problem with place-based partnership is we're in a partnership with Reading and West Berkshire, and Reading is certainly very different to the other two, and therefore has more need, and therefore gets the majority of the money, and that's and make sure that there is. Yes, fairness, and yes, it's right that they should get a good part of the money, but there's also need in West Berkshire and Wokingham. And you look in Oxfordshire, it's similar. Blackburn Leeds is very different to much of the rest of Oxfordshire, and I'm sure a lot of money goes there, but other parts need it as well. So we've got to make sure that we are realistic with what we do and don't just follow the data, because the data doesn't always tell the truth. Okay, thank you. We've got to vote, apparently, on accepting this letter. So it's from me. So do we have a proposer? I'll propose it because I wrote it. Do we have a seconder? All in favour? Okay, Thank you very much. Okay. So thank you very much for that, Robert, and for all you've done. So we're now going on to the Better Care Fund end of year reporting, and I think Lewis is here. Well, Lewis is on the screen.
Good afternoon. Bear with me and I'll pop my presentation up on the screen. Can everyone see what I can see?
Yes.
We don't know.
If you could say Wokingham Integrated Partnership.
Yes, welcome. Thank you very much from the Wokingham Integrated Partnership. Yes, absolutely. So here's our year-end reporting for our BCF submission. So this is retrospective, seeking retrospective sign-off. We've had a pretty good year. So a bit of context, we've hit all of our national conditions, which is all good. Our split for our funding is appropriate, and we've done well with regard to that. We continue to work on our key objectives and outcomes of the BCF, which is around health inequalities, that one again, hospital discharge and admission avoidance. Our BCF funds about 60 schemes across the borough, including finance for the voluntary sector, Berkshire Health Foundation Trust and council services, whether internal or sourced outside. So in terms of impact for our residents, this funding supports us to have more staff for all of our partners. So we're looking at it funds things like our reablement services, whether they're via our council-funded, council-purchased services like START and Collaborative Reablement Project. Our partners are the Intermediate Care Team from Berkshire Health Foundation Trust. It supports our magnificent voluntary sector with things like the Friendship Alliance, our Mental Health Alliance, our Mind Wellbeing Service, our award-nominated Keeping in Touch service. Within the council, it supports our hospital liaison team. It has a contribution towards the urgent community response for our colleagues in Berkshire Health Foundation Trust, supports us with our discharge to assess beds at Suffolk Lodge via Optalis, and our Wokingham Community Hospital for our colleagues in BHFT. It supports our primary care network social workers, which we're the first place in the country to have, and it supports us for our other MJ Award nomination, our Joy platform, which allows us to do our social prescription. So it's pretty impactful stuff. So as a part of our end of year reporting, we have to say, how has the delivery of our Better Care Fund gone? We have to talk about some of our successes, some of our challenges, and whether we have or we haven't hit our targets. So in terms of our delivery of our Better Care Fund, we either agree or strongly agree that BCF has been supportive. So the statement being, the overall delivery of BCF has improved joint working between health and social care. Yes, it has. It supports us with some of those schemes which I've just sort of discussed there. We've used our BCF funding to support 25 projects in our programme last year, including new services around discharge, admission avoidance and health inequalities. And it's also supported some work for partnership working within our PCN focused projects to support our GPs in primary care and to keep supporting that relationship we have with our primary care networks and our primary care colleagues. In terms of our schemes being implemented as planned, yes, all of our schemes have been implemented as planned. Of our 25 projects, we did have to pause 2, but given such a broad level of project work, it's not unsurprising. And given the high pressure of nature of work in health and social care at the moment, I think that's pretty significant as being a good job. In terms of delivery of our plan in 2022, has it a positive impact? Absolutely. It supports us to fund our schemes, supports us to fund our pilots to deliver things, supports us with improving the volume of staffing that we have, including transformation staff to make these things happen. And these things would otherwise be out of the scope of what it is that we can deliver. So the nice bit, the successes. So we've put forward a couple here. So we ran a pilot last year called the Collaborative Reablement Project, where we've upskilled carers to deliver reablement in the community. This is overseen with OTs delivering outcome planning and goal planning and checking and to deliver the training to make sure everything's going right. At the point of the last evaluation, the outcomes were roughly equivalent with the other services that we purchased, so that was a real success. In terms of the second success locally, I spoke about keeping in touch just a few moments ago. So our Keeping in Touch project is where our voluntary sector stick like glue to people who are at risk of admission. Referrals are coming through from our GPs and our urgent community response services. So that's the guys in BHFT that are doing that 2-hour and 2-day response to keep folk out of hospital as best they can. The voluntary sector have supported this cohort. So at this point, we're closer to 3,000 interactions because this is slightly old. So it's really, really great. On average, 9 interactions. Like I say, we're close to 3,000 now because we've been there, and over 80 organisations have been either referred to or involved through the process of the support of those individuals, which is really quite incredible. Our partnership has presented this to NHS England as good practice, and also, like I said, we've been at this point we've been shortlisted and presented for a Municipal Journal Award, which is always nice. So the less nice bit around our challenges. So as you can imagine, it's a pretty challenging space to be working in. We've had issues with data sharing, I think, and we always kind of will, but we're looking to work on that this year as a part of our project to look at how it is that we can get data sharing agreements and or honorary contracts for staff to see how it is that they can work better. So as an example of this, in terms of last year, we don't have access to quote unquote live lists. So that's where our hospital are looking at the people that are coming through the system to become discharged fairly shortly. At the moment, we're working on something called TINA. Please forgive me, I cannot remember what the acronym stands for, but it is the software which is used in our hospital to access live lists. So hopefully that should be able to support us. So whilst it has been a challenge, hopefully with the work that we're going to do this year around information sharing agreements and also some access to new software, fingers crossed we should be able to get at least part of that bit licked. And then the last part is around resources. I mean, essentially, workforce pressure has been very real. We haven't been able to launch some of our projects or programs, initiatives, schemes until much later into the year, so sort of January, February, March time, due to the pressures that were within primary care and adult social care staff, and recruitment has been difficult for all of our partners this year. Anecdotally, our voluntary sector are starting to report that they're struggling to start to recruit at the moment as well, which is unprecedented in our area in the country. So on to some more good news. So for the first time ever, Wokingham system has hit its targets for the Better Care Fund, which is the most fabulous news, and in no small part down to the brilliant work that have been done by all of our partners this year. So what does this mean to the man on the broad walk? So the first one is around hospitalizations. There's something called an ISR rate. It's very complicated to get to, but what does it mean to you or I? So we have, in the cohort of people around those ambulatory care sensitive conditions, we have 7% fewer admissions this year compared to last year. And Berkshire West as a place continues to be in the top 10 best performing, i.e. avoiding the most admissions, not having the most admissions for this particular cohort. And again, in no small part, this is down to kit and the fabulous work that's being done there. Also, our colleagues within Berkshire Health Foundation Trust with the urgent care response, and also our voluntary sector and GP colleagues doing all their darndest to keep those folk at home as best we can and keep people independent and unhospitalised, which is really great. Next up, we have normal place of residence. So this means you go back to the place from whence you came when you go to hospital. So we had a target of 91%. We've achieved 91.5%. So we've got over there. So this is a sustained improvement over the last 2 years. That means more people are going back to their normal homes, back to the places where they came from. So that means keeping people independent. A little bit of a shout out here for our Age UK Home from Hospital service for those that are in Pathway Zero. So that's the folk that are coming out without support. They have a just under 2% readmission rate for that service, which is absolutely incredible. Next, we have care home admits. That isn't 351 admissions to care homes, I hasten to add, so that's 351 per 100,000. We aren't that high locally. So we averaged 7.4 placements per month last year. That's down from the year before, and the third year in a row where we're averaging in the 7s for placements into permanent placements into care home as coming out of hospital. So again, really positive stuff. So that means obviously fewer residents having to move into those care homes, which is obviously really great. And then last but not least, we have our 91 days. So this is for folks that have been discharged from hospital. Are they still where they were discharged to 91 days afterwards, i.e. not back in the hospital? So here we achieved 87% of folk against an 84.9 target. So again, really, really good. No small part down to our colleagues at the urgent care response, also our reablement services here. So you're looking at the likes of START, our collaborative reablement project, which I mentioned earlier, and also our intermediate care team doing really fabulous work, and those home from hospital folks from HUK. So overall, pretty good message, pretty good year to be had, and I can speak personally to say how proud I am to have the pleasure of working with our system to achieve such good outcomes for the residents in the borough.
Thank you,
Any
Lewis.
questions?
And I think first of all, we must say, hitting the targets, you said you didn't know anywhere else in Berkshire, and certainly it's the first time that you've known anyone hit the targets in 13 years of work. So thank you very much, but also thank your team, the voluntary sector, the NHS, because you've all worked together and you've led it though, and that's very important. So thank you very much indeed.
Very kind of you to say. I get the pleasure of turning up and writing things down. Everyone else does the hard work.
Has anyone else got any questions?
Not a question, but I remember when the Better Care Fund first started, and what a long way it has come. Yes. No, so congratulations.
Okay, I think, you know, like I say, 60 schemes, 60 odd schemes being supported in the borough. Fabulous work across all of the different partners. I've had the pleasure of being able to highlight something from all of our partners whilst we were doing that piece of work there. Yeah, it's really, really good. No man stands as an island, so to speak.
Susan.
Hi, thanks very much for that, Lewis. That was a really great presentation. The question that I wanted to ask you was, with regards to the percentage of people who discharge from acute hospitals to their normal place of residence. I know it says 91%, which is great. What does that mean in terms of like numbers, the number of people? You may have already said, so I apologise if I missed that. Broadly speaking,
I'm going to have to pull up another spreadsheet, so excuse me for a moment.
It's just helpful to get the volume of that we're actually talking about here.
Yeah.
Because it's the people, their families, and that kind of thing. There's a wider really impact, isn't there?
Residential reablement. So you're looking at roughly. You're looking at in the region of so last year was 575. Sorry, for discharges. We're looking at 576. 576 discharges.
Okay, thank you.
Oh no, sorry, forgive me. Wrong outcome.
Okay.
Denominator. So we are looking at including Pathway Zero, about 2,500.
Oh wow. Okay, that's a lot.
Which is really great. I mean, I think the thing for us is that we only so we have the 4 pathways. We have Pathway Zero, which is the folks who are perhaps more independent, who will then go in and then come out with the support of a loved one. Or a family friend, etc. Those are the discharges that we don't really quote unquote touch within adult social care or the health service as a whole, and that's where the fabulous work of our voluntary sector really kicks in.
It's
the folk that aren't in a high level of need, those folks that are on pathways 1 to 3, obviously, with pathway 1 being home with support from reablement, pathway 2 being into a community hospital, pathway 3 being a care facility, so to speak. We tend to see more of the 1, 2, 3. But like I say, that Pathway Zero, the holding work, which is done by our KIT project, the work that our Friendship Alliance do with regards to supporting people to maintain that independence and build that resilience, our Mental Health Alliance that do very similar things, is all so fundamentally important that allows the focus of adult social care and our health colleagues to really get to those high needs, complex people, which we know all about. We know that the number of people over 65 is growing. We know the number of people over 80 is growing. We know that people are living longer, higher, with higher levels of complexity and comorbidities. It really allows us to be able to do a really good job. And like I say, we can only do it all together, holding hands, so to speak, which is why our fabulous logo shows that.
Yeah, that's great. Thank you. And it does underline the importance of the voluntary and community sector as part of the partnership and the system. So thank you.
Stephen.
Thank you very much, Lewis. both for the very positive news in the report, but also for the very positive way in which you presented it. I just really wanted to pick up on the point that Susan just made and came through very clearly in your presentation, the fundamental importance of partnership.
Yes.
This is about effective partnerships and working well with partners, and I think that's what it's all about.
We're very lucky in the sense that we have good representation from all of our partners at our integration board, which we call Wokingham Integrated Partnership. Everyone, we do see good attendance from all of our different partners, and it allows us to have open, honest, frank conversations where the pressures are, and allows us to hopefully, get to the bottom of that. So, we're very lucky that such people are so interested in working together and getting good outcomes together.
Okay, I think I can't see any more questions. Oh, yes.
Not a question, first statement, and at the risk of being the less positive person in the room, it definitely we've achieved our targets, and the Wokingham Integrated Partnership and the BCF works tremendously well, and all those things that Lewis covered are true. More admissions avoidance, more discharges than ever, and more working together to support that. But it is important to state that the hospital has probably been under much more pressure than it's ever been, and the system is, so the level of need and the resource gap to support that does not really match what needs to happen, even though we've done really well and performance has improved, and it's probably worth just stating that as well.
Yes, thank you, Martin. It's something we must always remember, that the pressure on the hospitals, and therefore on us as well, it goes on getting more and more intense. And certainly this year, to reach the targets will be harder, and it was hard enough last year. And that's part of the problem. And the carrot keeps getting harder and harder to get. So, but thank you very much, Lewis.
Thank you very much. I'll see you all soon. Take care. Bye-bye.
Now we've got the Wellbeing Board annual report, which Lyndon's going to present, I believe.
Thank you, Chair. For those I've not met before, my name's Lyndon. I work in the public health team here in Wokingham. Excuse me. Not going to present so much, but I'll give a quick intro and overview of the report and explain what we're trying to communicate with it, rather than go through all of the details. Quick little bit of history. The 6 strategy interaction priorities mentioned in the report, 5 of which mirror those in the Berkshire West Health and Wellbeing Strategy. Each of those strategies was mapped against what we call an action group or a partnership group. So, for example, if there's a priority related to children and young people, the CYPP, Children and Young People's Partnership Group, oversee that. Those related to physical activity have been mapped to the physical activity group. And what those groups have done, they took those priorities and then they were tasked with coming up with action plans to set out the interventions required to deliver against those priorities. But what they also did was put a bit of a local lens on them. So look at what those priorities mean in Wokingham and make sure the plans that were developed had a very local focus. That's why when you look through the report, you'll see under each priority, there's also kind of local focus, as we've called it in there. In terms of format, we've gone for something a little bit different this year. We've tried to move away from the overly heavy narrative. And that's why we've chosen that. We said we did type format and the 1-page summary for each report. I'm not sure we've been entirely successful. It is still very wordy. And there's more work to do to get it to exactly where I think we want to be. The aspiration is to make it a lot more kind of outcome impact focused. So it really is highlights the things that are important to residents and stakeholders. And as well as that, we want to try and move to a place where we can identify a few key performance metrics for the various priorities to give us a benchmark to look at quarter to quarter or annually, whatever's appropriate. Lewis's presentation just before gave a good example where the BCF has some quite clear targets and KPIs that we can measure ourselves against. And we do want to get to that point with a lot of these objectives in this report as well. The groups are in different places in that regard, though. Some probably further ahead and are in that space. Certainly the CYPP, I think, are a bit further ahead there. Other groups, it's not always entirely relevant that KPIs aren't the right thing, but we do generally want to move a bit more towards that space, and that's how we hope the report will progress as we go forwards. There's a lot to cover. It's very, very broad, even in the summary format it's in. There is so much work going on, from the work in the LD space and the accommodation product, delivering new homes at Rice Green and Loddon Bridge, the work of Optilis with their employment scheme that I think they believe they are second nationally in terms of their success rate in supporting people with learning disability into employment. In the physical activity space, we've supported thousands of residents to join active ageing and moving with confidence schemes. So they're the schemes that help those people that may not be as active as we like or they'd like due to long-term conditions. And it also helps addressing social isolation and loneliness, which I know is another key target for us. And we've got a lot of work going on in that space through our dedicated social isolation and loneliness group. Not only are we championing and supporting people to access activities across the patch that allowing them to make new social connections, but we spend a lot of time doing work looking at what the triggers are for social isolation and certain groups within our community that are more likely to be social isolated, and how we can change the way we do things to support them. So like I say, an awful lot going on. It's difficult to summarise it all in one report. We have had to make quite a few edits to get it onto one page. But just on that note, we do have more extensive reports for each group that are in the old format, kind of more wordy documents that we can share if needed. Just finally to say, the reason it's listed as draft is some of the group's priorities aren't set in a financial year timeframe, if that makes sense. So some of the 23-24 objectives may change a little bit in line with their national policies and guidance and submissions get done. We're not expecting anything major to change, just to note that there could be a few tweaks in that area. Happy to field any questions about the report. I may have to refer to others around the room if there's some specifics about key work of the group, because I'm not linked into every group there. But if we can't answer the specific question today, happy to take them away, pick up with a relevant lead and come back at a later date. So that's my spiel. Thank you.
Thank you, Lyndon. Have we got any questions at all? Everyone seemed quite happy with what's been said on the report. What's a surprise?
It's not a question. It's just a statement in that obviously we look at the detail reporting around this in our delivery group every other month. So this is just a summary of the activity of the year. So I'm not surprised there are a lot of detailed questions, because that's where we have the discussions.
Okay, thank you. Need to approve this to recommend to council. Yeah. Oh, sorry, Helen.
It's quite all right, Chair, and good evening, everyone. I suppose I just wanted to come in and reference that we are undertaking a refresh in the Children and Young People's Partnership. So we have a planning day, a planning session on the 3rd of July, where we're going to be reviewing the existing Children and Young People's Plan at a partnership level and setting new priorities. So this will be a strategy that will be available later in the year. I should also comment that we are also undertaking a refresh on the special educational needs strategy, because the current strategy doesn't really capture the significant work that we have underway in terms of SEND improvement and the safety valve programme. So just coming in with some views here about, the fact that we are refreshing a number of key strategies underpinning this work. Thank you.
Thank you, Helen. It's good to know that, that's something which is important, that you, if it needs to be refreshed, you refresh it. You don't just say, we'll go on and, keep push up with it, and that's very positive. Thank you.
Thank you.
So I need to propose this to take to account this to approve this report to take to council. Do I have a seconder? Stephen, we have a seconder. All those in favour? Okay, thank you very much indeed. So we move on to the forward programme. I think this is when Andrew Statham, who's from from the Royal Berks, and he's going to come onto this board, but we have to. Well, I'll have to propose that you come on. And would you like to say a little bit about yourself first? Do come and join us.
Yeah, I'll find the microphone. Thank you, Chair. Yeah, I'm Andy Staving. I'm Director of Strategy at the Royal Berks, and I've been working closely in the Berkshire West system with Matt and with Belinda, and also as part of the unified exec with colleagues there. And one of the things that we've been reflecting on as a hospital is that we need to make sure that we are representing ourselves well and making ourselves available to Health and Wellbeing Board and other local authority structures. And so I've kindly been nominated from the director team to be that representative and that point of liaison with yourselves here in Wokingham. So I'm really happy to be here, and if you'll have me on as a representative, I'm really honoured to do that.
Thank you very much, Andrew, and I'd like to propose that we nominate you to the board.
I'm very happy to second that nomination.
Stephen, all those in favour? And the constitution's also got to be updated, so that's the other bit that I've forgotten. So, so that we don't have to go through this kind of procedure if someone else joins us. So all those in favour? Has anyone got any other things for the forward programme? I know something that might not be in this one, but certainly the other one. That we've been offered training for adult safeguarding, and I think that's important to take up, because that's something which I believe is all too easily missed. So I think training for adult safeguarding. Sorry, it's hard to look at the screen as well. Ingrid, you've got your hand up.
Sorry, Chair. I don't know if it's AOB or a suggestion for the forward plan, but I was going to raise this evening about the local pharmaceutical committee, the LPC, which I know we have an interest in working with, and that's the representative group of all the NHS pharmacy providers. And we've had David Davis here before. He's the representative of that LPC, but it was the Thames Valley LPC, and we've just recently had communication in the last couple of months that our Thames Valley LPC is merging with Buckinghamshire LPC and becoming a much bigger organisation, obviously across a broader footprint. I don't know if it gets bigger in terms of resource. And I just wondered whether it might be helpful to have him come and talk to us and explain through those changes. So that was something I was going to raise.
Thank you, Ingrid, and I think that would be helpful. Certainly, there's often problems with pharmacies in this country, in this area, and so on. So certainly, that's something which we need.
Chair, subject to officer advice, my suggestion would be asking for a report or annual on GP performance in Wokingham, because I know it's a key concern to our residents.
Yes. Who would that come from? Because there's all the groups of GPs, but who is there? There isn't really one person apart from in place.
I think we need to take that back, because it could be the chair of the PCNs, or it could be the assistant director of primary care for Berkshire West. So I think we just need to take that back and get that detail. Or it could be as well the clinical director for one of the PCNs. So yeah, if we take that back, we can then confirm. Okay.
Thank you very much.
I don't know whether this is even possible, but it's something that, looking at the forward programme, is kind of missing, which is the more on the wellbeing side, and whether we can have a report at some stage on the impact of our leisure offering on people's health and wellbeing, take up of different things. And I know we've got a lot of things that we promote for other people. I mean, one of them was in the better care in the not the Better Care Fund, the annual report about Shine, and for example, but also we've opened some new leisure facilities in the borough, and it would be good to know whether there's uptake of those facilities and whether it's helping people's health and well-being to improve. So I don't know when we'd want that, but I feel like it's a gap at the moment.
I think that's very true, and it's also finding out whether it's just the healthy who go and get more healthy, or whether it's those who aren't so healthy who go and improve their health, and that's the important part.
Yeah, that's the bit I'm thinking about, the inequalities bit as well, and whether we're pricing things right, and whether people have access to all those things, and whether we're reaching all the diverse bits of the community with that offering.
I think actually that's quite a lot of work, but
Yes.
we'll try to sort that out, because there's a lot of parts to it.
But I think it will need to come from a number of places, and we need to have a little think about how we do that. So I think it's a good idea, but because that might be a bit tricky, we just need to make sure it's on the forward plan in the forward.
But not too far forward. Not too far forward, or we'll never get it done.
No. But yeah, not for next meeting. But yeah, I understand the challenge. So I'll have a chat with Ingrid and other colleagues.
Yes, at the moment, December's looking fairly not having a lot in it, so it might come then, and that's long enough to give you some time to get it, to get out these ideas. Sorry, has anyone else got anything that they feel they want to raise for the forward plan? Okay, well, thank you all very much for coming, and we'll see you next in August. So we'll see you next in August, but between that there's a in-house time as well in July. So I look forward to seeing you all again. Thank you very much.